than you did, right? It's anachronistic to the concept of community and sharing and mutuality and sharing benefits and burdens, right? I'm wearing a mask to protect you. You're wearing a mask to protect me. That kind of sharing and mutuality is repugnant to this bailout, you got this much, I got this much. But if you want to go to who's getting bailed out and who paid what, nobody would be bailing out New York State. New York State has been bailing them out every year for decades. If you want to do an analysis of who is a giver and who is a taker, we are the #1 giver. The #1 giver. Nobody puts more money into the pot than the state of New York. We're the #1 donor state. And if you want to look at who happen to be the donor states, who are the giver states, they are the same states that they're talking about now. Who were the taker states? Kentucky, southeast part of the country. And by the way, I understand we're one nation. You put into the pot what you need, I put in what I need, you take what you need, you take what you need. And that's the way it's always been. But if you actually want to call for an accounting, which I think is repugnant to this time, and I don't think it's constructive, and I don't think it's healthy, but if you want to call for an accounting, you're making a mistake, because you lose if we do an accounting. You lose. And you happen to be 180 degrees wrong in what you're suggesting.
So that phrase, bailout, is not helpful, you would say?
I would say, first, at this moment in time, when people are working together and people are sharing and people are sending ventilators across the nation to be helpful, and 60,000 people are volunteering to help New York State, and they're showing love, and they're showing unity, and they're showing mutuality and community. That is such a beautiful moment, right? And it tends to happen after a crisis. We saw it after 9/11. People just come together. We're Americans first. We're not Democrats, we're not Republicans, we're not East Coast, we're not West Coast, we're not Northern, we're not Southern. We're just Americans. That is such a beautiful, special moment. To now say in the middle of that moment, who owes what to whom? What? You want to talk about money now? This is not about money. It's about working together and helping and sharing, and people are dying, and it's about grief, and it's about comfort. It's not about money. But if you want to make it about money, you're making a mistake, because you're going to lose on a tally sheet, and it's not even going to be close. But you want to tally up who owes what to whom? Go ahead. It's not even close.
Is this a turnaround from what you said last week?
Let's go next.
Governor, where do casinos fit on phased reopening? Would you consider those an attractive nuisance?
Casinos, you'd have to look at the industry and how they're going to conduct their business. You'd have to do social distancing. You'd have to have monitoring. It's going to be difficult in the context of a casino, but depending on the casino, not impossible, but you'd have to look at it on an individual basis.
Governor, we're hearing about a security breach at the Department of Labor regarding unemployment benefits. Some people are messaging me saying that they've received mail with other people's information, including social security numbers, and I'm seeing this in other parts of the state as well. Do you know of the breach?
I've not heard about that at all. Has anyone heard about that?
So there were, I think it was 36 people who, and it was a human error, it wasn't malicious, where 2 pieces of paper were stuck together and sent. Those people have been contacted. The ones who have not yet will be contacted today. They're going to receive free credit reporting and surveillance for a year, and they're making sure to process those claims as a priority. But yes, it was human error, it was not malicious, and it's being dealt with.
Unemployment, Governor.
I'm sorry.
I'm curious, as time goes on, I mean, every day we're getting message from people who are losing their jobs because of this. Does this state have the money? Do we have enough money to keep paying out unemployment as more and more and more people become unemployed during the pandemic?
No. That's why the federal government has to provide funding, because we don't have the money.
How much do we need for unemployment?
Well, it depends how many people moving forward ask for unemployment benefits and how long it goes on. But it's in the billions of dollars. There's no doubt about that.
Governor, what's the current testing capacity in nursing homes, and how does a nursing home go ahead? Because last week you said that they are doing testing in nursing homes. How do they request the testing? And then also, you were talking about isolating certain facilities regarding the reopening process. Will that be available for nursing home operators to send patients that are COVID positive? A few other states like Connecticut and Massachusetts have started doing COVID-only patients to take the burden off of nursing homes. So
Yeah,
one on the testing and then two
yeah.
on the isolating.
We do that already, right? If a nursing home has a patient that they can't handle, COVID or whatever the reason, they must refer that patient out of that facility. They must. If they cannot handle, if they cannot provide appropriate care, they must transfer that person. Either they can transfer the person on their own, or they call the Department of Health, and Department of Health will transfer that person. Department of Health can transfer that person to a COVID-only facility, which we have. But it has to start with the nursing home that is the primary care provider saying, I can't provide care for this person, for any one of a number of reasons. I don't have the staff, I don't have the PPE, I don't have the ability to quarantine them, I have too many COVID patients, I'm too tired. It can be any reason. If they can't provide the care, then they must transfer that person. Department of Health can put the person in a COVID-only facility or whatever facility they have that's appropriate for that person.
So where are these COVID-only facilities? Because last week, that wasn't an option, it didn't seem like.
Yeah, we have had COVID facilities. We have COVID-only hospitals. Downstate is a COVID-only hospital. We have why the Comfort wouldn't take a transfer from a nursing home. Because the specific protocol on that specific ship said that people have to come from a hospital, because when they come from a hospital, the hospital does the full workup. So when they are referred, they're referred with a full workup. But yeah, you can't refer from the nursing home to the Comfort. You can't refer from a nursing home to the Marriott Hotel. You can't refer to the Hilton. Yeah, I know. But that nursing home can call any other facility or can call the Department of Health, and the Department of Health will take that person and find a facility. So, yeah, they can't refer to the comfort. I know. They can't refer to the New York Post either. I mean, what does that mean?
Right, or if a patient is sick, why does it matter if it's a federal facility or a state
Because
facility?
it's a ship that the federal government was operating, and the protocol on that ship was they come from a hospital, so the ship knew what they were dealing with. Go ahead, Jesse.
Nursing homes treat patients all the time that are there.
Yeah, I know,
unmedicated.
but the protocol on that ship was it had to come from a hospital. But who cares about just that ship? If the point is that nursing home should have referred that patient and should have told the Department of Health, I can't handle these patients.
They were, and that's why because they needed more medical staff. And so the
No,
problem
then
was,
just, no,
there's-
just, I can't, just whatever reason they want. They call the Department of Health and they say, you take Bernadette. I can't handle her. And the Department of Health takes her. Now, when the Department of Health takes Bernadette, they no longer get paid for Bernadette. Oh, money. Go ahead.
So could a nursing home, sorry, Jesse, could a nursing home patient go to a hospital then? So if a nursing home is overcapacitated, they can't handle their patients, could a patient be transferred back to a hospital and the hospital could then care for this person?
Yeah,
That could happen?
yes.
Have you guys gotten requests for that? No,
Not yet.
not yet?
And would the nursing homes be open to regulatory scrutiny if they told the state that they can't
Let
care
Jessica,
for people?
we
No,
just
no,
do
no, no,
one.
please, go ahead.
Yeah, I was just bouncing off of Bernadette's point, just, if nursing homes were to tell the state that they can't handle a patient or they don't have enough PPE, or for whatever reason, are they opening themselves up to scrutiny from state regulators?
Not at all. They're opening themselves to scrutiny if they don't do that. If you keep a patient and you get paid for that patient and you can't provide adequate care for that patient, then you have a problem.
On the issue of antibody tests, you reported today that 25% basically of New York City residents are coming up positive on that? Is that
What was the number?
about 25%? Is it safe to extrapolate from that over 2 million New York City residents have been exposed to this and recovered? What does that information give us? What does those results give us?
Yeah, saying 25%. By this survey, 25% of the New York City population had the virus and now has the antibodies.
And what does that say about the death rate? What does that say about the severity of the crisis?
Much, much lower. Well, the death rate is much, much lower because it changes the denominator, right? This is what we talked about last week. You take the number of people who passed away, and we never knew what the denominator was, right? So if you want to know what is the death rate by percentage of those who were infected who passed away, yeah, it changes the denominator. And we had it down to 0.5%.
Just one more thing, Nick. Just on the issue of antibody testing, the World Health Organization said on Friday there's currently no evidence that people who have recovered from COVID-19 and have antibodies are protected from a second infection. What do you make of that?
Yeah, well, as we talked about last week also. You get different opinions on whether or not you can get infected again. Remember one time the conventional thinking was once you have the antibodies, you're immune. You can't get infected, so you can go back to work, et cetera. Now they're saying we're not so sure that you're immune. You may be immune, but you may not be immune.
Doesn't that complicate and change your calculations about how to reopen the state and even your approach to antibody testing?
Well, the antibody testing does something else for us. The antibody testing does two things. One, what is the infection rate? Which it tells you with a 2-week lag, because you know what percent were infected. Two, it tells you who can donate convalescent plasma. That it tells you. The third, the theory you're referring to is, well, now you have the antibodies, you can go back to work, right? We've never deployed that, and I don't know what that was really going to do for you anyway, because what percent, you actually made this point a couple of weeks ago, what percent are actually going to have had the infection, and can you really restart an economy on that smaller number? And now it's saying, if you believe the World Health Organization, you can't even say for sure those people won't get reinfected.
The point is not necessarily that people with antibodies would be able to necessarily return back to work.
No,
that theory's not operational anymore.
No. I mean, there's a theory, it'll go person by person, but you'd have to make your own calculated risk. You had it, you have the antibodies, my brother Chris, he had the antibodies, maybe you're immune. Yeah, maybe you're not immune.
Governor, the State Board of Elections today just now has voted to cancel the presidential primary, removing Bernie Sanders from the ballot. Was this the correct move?
I'm not going to second guess the Board of Elections. There are a number of, I know there are a lot of election employees of boards of elections who are nervous about conducting elections, but I'll leave it up to the Board of Elections.
How has the science evolved on wearing a facial covering in recent days? We went in a fairly short period from facial coverings, inconclusive, to a mandate and it being one of the better things you can do. So if the science does support it and has evolved, is the state indirectly responsible for the spread by not issuing that mandate maybe 30 days earlier when we started a response?
Look, when we do the retrospective, all of these things, you could argue, why didn't we do them a long time before? Why were we shaking hands? Spread all sorts of viruses and diseases shaking hands. Why didn't you wear a mask starting last year? Used to see pictures of all the people in China wearing masks, right? Why didn't we do it? I mean, it helps with the flu, it helps with a common cold, it helps with everything. And we did it more aggressively than just about any other state. We mandated it. As soon as people said, well, if you remember when it started, everybody was ambivalent. CDC, all the experts, right? We have a whole world of experts. All the experts were ambivalent about a mask early on. And then they said, basically, a mask couldn't hurt. Well, I said, a mask couldn't hurt, and it might help. So why not do it? And now they're even more emphatic that a mask helps. So I'm glad we did what we did.
On more than one occasion now, you've said that nursing homes lose money once they lose a patient. Are you saying that nursing homes are more interested in their profits than taking care of their residents?
No, not at all.
So can you elaborate as to what you're thinking is behind that remark?
No, those are just the facts of the situation. If they can't care for a patient, they have to transfer the patient.
Governor, there are reports that golf courses, golf clubs, are allowing golfers out on the course while driving carts. Are you concerned about that? And we've even heard reports that there are newspaper advertisements that are offering greens fees with carts. Should there be more monitoring? Should there be fines?
I thought we said no carts. Does anybody remember?
We said no carts, that's right. And so if people are violating the guidelines, then it should be reported up to ESD for enforcement.
And if they're,
That somebody report that.
They're not supposed to be using carts, and if they are doing it in violation of the directive, it should be reported, and there can be civil penalties.
and if they're doing it in an advertisement, that is really not smart.
Governor, Bill's training camp starts in July. Given the multi-phase plan that you have now, is holding an event like that in July in Western New York feasible?
I'll tell you the end of June. Go, let's take one more, go.
Is there a possibility that having those temporary hospitals at Stony Brook and Bolton Westbury will make students more reluctant to either attend or return to campus, knowing that maybe they'd be used at some point?
No, I don't think so.
Are there any?
In terms of unemployment, do you know when we would be out of money? Do you know when we would need the federal help just for unemployment?
We are out of money now.
Are there?
We are now running a $10 to $15 billion deficit.
And just
So we're out of money now.
And for your context, we paid out as of Friday $3.1 billion in unemployment already, as of this past Friday.